Just before we begin our special session on long COVID, followed by Ray Hadley, our closing speaker, we're going to start with COVID looking back.
Look, I guess if you're very new to health, then it must have been a very difficult introduction to the health system. For those of us who've been in it for a long time, it's been a very difficult period as well. But, you know, for me, it is hang in there. I think that sense of purpose that you get from working in health is something that keeps me going. It is about purpose and what you're giving to the community.
In the response to this terrible virus, everyone working in Sydney Local Health District has had a role in our COVID response, and we've been supported everywhere we've been. What we've achieved would not have been possible without all of you and without all of our amazing partners. In Sydney language, there is a word, Ricky tells me, Babanara, which means take hold of my hand and help me up. And I'm very fortunate to have all of you on my team.
The Sydney Local Health District team has gone above and beyond.
Amazing contribution.
One of the toughest years we've ever faced.
Incredible job.
It's unique amongst health departments.
Without New South Wales, Australia wouldn't be where it is. New solutions.
Keep our community safe, to go far and beyond.
This is a safe space. It's a safe space that you can trust.
The most amazing effort.
We are internally grateful.
And protect our community tremendously. I thank you for your service to the people of New South Wales. It's one of the most diverse and culturally rich districts anywhere in Australia. We are stronger together.
Partners, as friends, as colleagues.
And we're ready for a brighter future. Thank you for your courage, compassion and grit.
Marvellous. Hey. I know I speak for all of you when I thank our technical and communication team for that extremely sensitive work. Could you give them a really big round of applause? Well, ladies and gentlemen, we're going to look at recovery from COVID-19 and evolving services to meet patient needs. And our first presenter is Associate Professor Lauren Troy, a respiratory staff specialist at RPA. So would you make her very, very welcome?
I'd like to acknowledge the traditional custodians of the land on which we meet today, paying my respects to elders past, present and emerging. I'd also like to thank the organisers of this symposium and to Dr. Teresa Anderson for the opportunity to speak on our evolving outpatient and clinical services to meet the needs of patients recovering from COVID-19 infection. I'm going to describe the Sydney Local Health District post-COVID respiratory clinical services on behalf of my team at Royal Prince Alfred Hospital and the team led by Matthew Peters, Professor Matthew Peters at Concord Hospital. After this, I'm delighted to hand over to Associate Professor Lissa Spencer, the Director of the Pulmonary Rehabilitation Service at Royal Prince Alfred Hospital, and special guests Tina Casanidi and her daughter Chantel, who we've all met, who will be describing their specific experiences. And finishing this presentation will be Dr. Karen Chia, describing the newly created long COVID clinical service. I begin on a sobering note, but I really do promise to end with optimism. This picture was alarming to me. I didn't realise just how much COVID there still was in Australia relative to the rest of the world. This was only a week ago, and you can see we are amongst the highest rates around the world in terms of our new COVID infections. it is easy to speculate that perhaps we're just doing more testing than other places, and that's why we're seeing so many high numbers. But when you see this picture that shows the testing rates, our rates are really equivalent to the testing in the USA and in Russia, and we have many-fold higher new infections each day than those two places. And perhaps it's because we largely avoided the first two waves of this global pandemic that we're now seeing such high numbers, despite our incredibly high vaccination rates. So it's a problem that hasn't gone away. The Omicron era has created many, many challenges for the health services across the state and across the country. We have had a stubborn number of cases filling up at least one ward, if not two wards, across many of the hospitals in our local health district. And it's been a very long time in managing these infections where we haven't seen the numbers really decline until the last couple of weeks. Hopefully this trend will continue down. But it has been a big burden on the hospital, and not just from COVID infection directly, but all of the challenges in managing patients who have non-COVID issues that may have had delays in accessing healthcare over the last couple of years, who now present really significant challenges to managing their healthcare needs in our struggling, resource-limited system. This picture, courtesy of Dr. Sebastian Van Hal from our infectious diseases team, shows a snapshot of all of the different variations of Omicron that have been occurring within the RPA cohort and the Sydney Local Health District based on their genetic sequences. And you can see that the BA1 variant in purple at the start was the main issue until the BA2 took over, and now we're seeing a whole variety of BA2 subvariants. So it's a tricky virus. It's going to continue to cause us challenges. It's not going away, and so we're going to have to remain innovative in the way that we face this. The Delta wave was a really difficult time. You can see the peak there, though, was only half of what the peak was during the Omicron wave. But despite the fact that we had fewer numbers taking up hospital beds, they were sicker. They were really sick patients with respiratory issues. And you can see this because on our peak day with Delta, we had many more people taking up intensive care beds, and many were needing the highest level of support, that is ECMO, also known as lung bypass, to get through this illness. So Omicron put lots of people in hospital, but many were not in hospital because of respiratory issues. Many just simply had COVID and had other healthcare needs. In the face of Delta, it was really clear that there were a lot of patients who had a lot of respiratory issues that were going to need a lot of respiratory follow-up, but also functional issues needing functional assessment and ongoing rehabilitation beyond the admission. We knew that due to the constraints on our healthcare service, we were not going to be able to meet all of the needs within the admission, and we really needed to have some mechanism to follow up patients comprehensively in the outpatient care setting. And so in October 2021, the Sydney Local Health District established 2 comprehensive post-COVID respiratory clinical services at Royal Prince Alfred and Concord hospitals. And I think it's a real testament that when the Omicron wave washed over us and we were just getting these clinics going, that we were still able to deliver outpatient care to those who'd recovered or were still recovering from their Delta wave infection. And I really want to acknowledge my colleagues across the 2 clinics who were able to really carry forward these services. Just a reflection on the different types of people presenting with ongoing respiratory issues, having followed on from their COVID infection. There's the population who needed hospital care, and then there's the population who didn't, but who do have a significant burden of respiratory symptoms. And we're seeing both these populations in our post-COVID clinics. Those who are hospitalised really had and still do have a significant burden of weakness and functional limitation, particularly if they had a prolonged stay in hospital and particularly if they needed intensive care level support. The psychological trauma was very, very significant for many people, not just for patients but for their families. And then many people have a spectrum of respiratory abnormalities that linger and some are developing scarring or fibrosis, which is a non-reversible issue and presents long-term disability. Outpatients, however, have a slightly different spectrum of issues. So many have had exacerbations of pre-existing asthma or emphysema, or perhaps newly emerging diagnoses because of those things that have been unmasked by the COVID. Chest wall pain is perplexingly incredibly common in people who've had COVID. Particularly, it's the main reason why people were attending emergency. Many were not seen to need to stay in hospital because there was no alarming or significant or life-threatening cause for that chest pain, but the chest pain has continued to plague people many weeks and months down the track. And also, breathlessness has become a pervasive issue for many people who've had COVID for reasons that are really not immediately apparent. And then the spectre of long COVID syndrome really hangs over both of these clusters of patients, and that's really where we're going to have to focus a lot of resources, and Karen will be talking about the services that are under development in the Sydney Local Health District. And what we know about long COVID is fairly limited, but it seems to be non-discriminatory, and it seems to be pretty unpredictable about who it affects and how it affects them. So this complicated schema, I won't go into too much detail, but it's the model of care that we developed in Delta to address the burden of respiratory and long COVID issues in our patient and community populations. And we started to get an awareness of these populations, not only because of the more than 1,000 patients that we'd cared for in the hospital setting, but the many, many thousands of patients who'd been managed by RPA Virtual. And that number there is really what we saw in Delta, but you can imagine it's many-fold higher now post-Omicron. This is our post-COVID respiratory team at RPA, and we're very fortunate to have recruited some really phenomenal clinicians to this job and this team. People who've had a really broad array of experiences, including 2 former intensive care nurses who actually cared for some of the patients who we're now seeing in the clinic. We have Lisa Spencer, who'll be talking shortly, and her physiotherapy team, and my colleague there, Alan Teo, who shows a strong interest and a compassion for patients who've recovered from COVID. We have a similar model of clinical care established at Concord Hospital, and both clinics see patients every week. The care model involves case management of patients, which is done so well and so comprehensively and with such compassion by my nursing colleagues. Every patient coming into the clinic has detailed lung function testing. They get a physician review and imaging and other investigations as indicated. They get a comprehensive physiotherapy assessment of their functional status, including some of the WHO-validated functional assessment tools, and they all get given brochures that are put out by WHO on how to use their energy, how to recover, what sort of exercise is safe for them, and many will be referred on to pulmonary rehabilitation. And many will also benefit from a referral to the clinical psychology team under RPA Virtual. These statistics are now a bit outdated, but we've now seen nearly 200 patients with nearly 300 occasions of service across the 2 clinics. As I said, this was despite the Omicron wave using up many of the resources. And most patients will really only need 1 or 2 visits to the clinic, but at those assessments, the proportion of those with ongoing respiratory and functional issues is incredibly high. We still have many active patients that we're following up and assessing, but fortunately we've been able to discharge a good proportion to their general practitioners because they've recovered. Some, however, have ongoing disability and need the ongoing chronic management under the tertiary level interstitial lung disease clinic that we've already established at Royal Prince Alfred Hospital, or other chronic disease clinics. We're building up, that number 3 is actually really, it doesn't represent the scope of the problem. We're starting to take down names of people who come to our post-COVID clinic who we know fulfil criteria for the long COVID syndrome, and starting to be more and more aware of this issue, particularly as we move through the Omicron era. There are several research projects that have evolved from this clinical service, including a 4-week randomised control tele-rehab trial led by Professor Jenny Allison, and encompassing all of the outpatient physiotherapy services across the district, Canterbury, Balmain, RPA and Concord. And it's a really impressive study that's currently recruiting. There's a post-COVID physiology observational study being undertaken at Concord Hospital, and we are also creating a database to follow longitudinal outcomes of patients who've come through the hospital setting and are now being followed up in the clinics. The best part of working in this clinic is the human interaction. I feel so privileged to be able to have this sort of interaction with people, particularly after the depersonalised clinical interactions that we've been having with people over the last 2.5 years. Telehealth is wonderful, but it doesn't come close to a face-to-face interaction with the people that you cared for in the hospital and their relatives who were unable to be by their side when they were at their sickest. The very enthusiastic group in the bottom left-hand panel are the Zoom rehabilitators, and they all very graciously agreed to have their photos taken while they're enthusiastically Zoom rehabilitating. We've got Peter there on the right, who's doing really well after an intensive care admission, and Grazia on the left, who just celebrated her 91st birthday. And this little guy on the right, he was born at Royal Prince Alfred Hospital on the 21st of December. It was an emergency caesarean section. His mum was deteriorating rapidly with COVID pneumonitis. She went on to be intubated, mechanically ventilated. She received ECMO. She was on ECMO for many, many weeks. But amazingly, she was able to recover, and she was able to be stepped down to the ward and rehabilitated, and she went home in late March. And I saw her and her husband, and that was only a week ago, and I'm so pleased to say that she's doing really, really well. And this is the reason why we do this clinic, and this is the reason why people in the hospital go to work every day, because some of the outcomes are incredible and most people's lives are better because of the care that they receive. So there's obviously many things looking forward, because as I said, COVID's not going away, but there are, I think, really interesting lessons that we've learned from establishing this model of care, which spans a bit of telemedicine and a lot of face-to-face. And I think that we can transplant this model of care into other chronic diseases, particularly where there's been a high acuity episode needing intensive care management and a long rehabilitation afterwards. And so we've got lots of plans for taking this clinical service forward, and particularly firming up the relationships and collaborations that we've formed with many of the stakeholders due to our necessity under extremely trying circumstances during the peak of the pandemic. And I'd just like to end before handing over to Lisa and to Tina and to Chantel with just acknowledging the many, many people who have contributed to both the inpatient management and the outpatient clinical follow-up. I'd particularly like to acknowledge the nursing staff who have really borne this on their shoulders with such incredible high levels of professionalism, and I'm really honoured to work with many amazing nurses. But also special thanks to Dr. Teresa Anderson, Professor Michael Hensley, former GM, Mr. Nobby Alcala, Professor Warwick Britton, Ms. Sarah Whitney, and Professor Paul Tosillo. Thank you.
Ladies and gentlemen, if I could ask Associate Professor Lisa Spencer and also Tina and Chantel to take their places. And as they come up and this interview will continue, I just want to say on all our behalves a huge thank you to you, Lauren Troy. I feel that you gave us comprehensive information, but I also, don't you think we felt the absolute gravitas of what people have been dealing with? And I just thank you to you and your team for the work that you do. Thank you.
Good afternoon, everyone, and thank you so much for staying. Julie did a very good job encouraging you to stay. I would like to welcome Tina and Chantel, who have had a very long journey together through COVID, and I think it's really important that you share your story, Tina, because it's an amazing story, and we've all been on it with you. but a lot of it you don't remember. But here you are. And so it's really incredible. And so Tina I've sent her a few questions, so she wants me to keep to script, don't you? So firstly, I'm going to ask you, Tina, to tell us a little bit about your COVID journey.
Okay.
Up to your mouth.
Yeah, right near your mouth.
Sorry.
Tina.
Okay. It all started in June 28, 2021, when I got a phone call from New South Wales Head Health that I had tested positive to COVID-19. I didn't think much of it. I was feeling okay. And then 2 days later, my temperature reached 39.9, and I was starting to feel like I couldn't breathe and had aches and pains through my body, hot sweats to the point I had needed to change my pajamas and bed sheets, dry cough and very tired. The nurse that was monitoring me on Zoom suggested I go to the hospital straight away. The paramedics came. I got to RPA hospital and gave my Medicare card to the nurse, and that's all I remember. I was in hospital for 3 months. 22 days induced coma. For my body to recover and fight the deadly virus and pneumonia at the same time. 9 weeks in ICU. The virus wouldn't leave my body.
Tina, you're doing a great job. Everybody's on this journey with you. Yeah, it was very hard for you.
It was.
And very hard for your family.
It was very hard.
How did it affect you, Chantel?
It was very hard because we were all in isolation at the same time. We couldn't leave the house, see each other.
So you all had the COVID together?
We all had COVID together.
That's right.
We didn't know the outcome.
No, that's right. Very frightening.
Yeah. It was.
Very frightening time. I think I first met you, Tina, when you were in the ward.
Yeah.
And your trachea was out and you were starting to learn to walk again.
Yes, I couldn't walk. My whole body shut down.
I know. Amazing.
Yeah.
And Tina, tell me, where are you now? How are you going as far as your health goes? Question 2.
My breathing is still worrying me. Still find it hard to breathe when I try to tidy up the house and when I walk up the stairs. And if I walk too long, I still have numbness in my feet and pins and needles. I have to stop. After 8 months, I've been in hospital. It's still a worry for me with my feet.
Yes, your feet.
And my breathing, yes.
That's right. Has it improved over time, Tina?
It has, yes.
Slowly.
Yeah, compared to how I was.
And I think the interesting thing for all of us is that it's a different journey for everybody. And as Lauren said, we're seeing different stories in the COVID clinic. Some people have coughs, some people have breathlessness, some people have these funny aches and pains.
Yes.
And slowly, it's really day by day, isn't it?
Yes.
And tell me...
It's a long journey.
It is a very long journey, isn't it?
Yeah.
And thinking about your whole journey, Tina, what went well in your care? Do you remember any good things about the whole journey?
My family had COVID at the same time as I was admitted and were all in isolation. I can only imagine what they were going through. It was very hard as my family and friends could not come to the hospital to see me. This put a lot of pressure on them. everyone was terrified.
You're doing a great job, Tina, and it is terrifying. Is that how you felt, Chantel?
Yes.
You did?
Very terrified.
Terrifying. And it sticks with you for a long time, doesn't it, Tina? Yep.
Knowing what I was induced coma for 22 days. Just like that, and not knowing the outcome. Every day that went past was really hard for my family and friends, especially my kids, heartbreaking.
Yes, very heartbreaking, isn't it? And it must be, that's all right. Would you like a drink of water? No, it's okay, take a deep breath. And seeing you now is wonderful for them, even though you've still got aches and pains. You've come such a long way, haven't you, Tina?
Yes,
absolutely,
I have, yes.
Absolutely amazing. What can we learn as health professionals from this journey? Because we want to learn how to help you all best.
Look, they did everything possible to save my life, especially through the beginning of the Delta deadly strain, when doctors and nurses didn't know much about this deadly virus. I was very lucky to be surrounded by doctors and nurses 24/7 that saved my life.
That's fantastic, isn't it? And everyone works so hard, as we've heard.
That's right.
And it was rewarding for us seeing you recover.
Yes.
And teaching you to walk again.
Oh, yeah, I had to start all over again like a baby.
Like a baby,
Yeah.
that's right. Tina, you've also been doing some tele-rehab.
Yes.
How have you found that?
That was amazing. I couldn't do without them. I'm at this point because of them.
Oh, great. You really enjoyed it?
I enjoyed it. I loved it.
And you zoomed in.
I was really looking forward to it.
Oh,
every
great.
time. Yeah.
So Tina zoomed into tele-rehab twice a week for 8 weeks. And the students, and we all exercised with you, didn't we,
Yes.
Tina? So, and a few other
Yes.
patients as well.
They're
So
amazing.
it was like a group, wasn't it?
You got the energy.
Yeah, so that you did well with that, because it's a scary thought to do exercise, but you did very well.
Well, I'm the way I am now because of Zoom.
That's great.
It was fantastic.
Fantastic.
Oh, yeah, I really, really appreciate it.
Oh, that's great, Tina. We appreciate you sharing your story with us, and I know Julie's going to give us a wrap up in a minute. But just to just to finish on, so looking to the future, what are you looking forward to?
I wasn't able to walk, talk, swallow, eat or drink. All my muscles had shut down. I had tubes and needles all over my body. I had to start all over again, just like a baby. Once I was able to do all this, I was sent to Metro Rehab in Petersham to help me a lot. I did OT, speech therapy and physio, and doing my online Zoom, which was amazing. Classes had helped me so much, and I thank God every day I'm still here.
That's great, Tina. Yeah. It's wonderful that you can appreciate everything.
I do.
And have you got anything special you're looking forward to? I can think of one
God,
thing.
Yeah.
I can think of one thing. Here comes the bride.
For me to recover the best I can and get back to my normal self and see my beautiful daughter walk up the aisle and get married in October next year.
Fantastic. Thank you, Tina. Thank you, Julie. We'll hand over to you. And thank you so much, Tina and Chantel, for sharing that with us.
Thank you. That's the understatement. Thank you so much. Thank you. And thank you also to Lissa Spencer for teaching us, Ray, how to do an interview. Would you give them all three a very warm round of applause? And just a quick final comment from Dr. Karen Chia, rehabilitation medicine specialist, to give us a sense of the future of rehab. Thank you.
Thank you, Julie. A very big thank you to Tina and Chantel for sharing their story. It took a lot of courage to get up in front of us all, so thank you. And thank you, Lissa. I also just wanted to quickly say a big thank you to Lauren and her amazing team for all the work they've done caring for our patients recovering from COVID. They've really been outstanding. And we turn now to consider long COVID. I hear you ask me, what exactly is long COVID? When the pandemic first exploded onto the global scene, it was a thought that recovery would take a few weeks, if that, and perhaps a little bit longer for people who had severe illness. However, this was not the lived experience of people recovering from COVID. People recovering from COVID found that they were struggling with protracted, lengthy recovery, involving symptoms that were very unexpected, things like brain fog, severe fatigue, loss of smell, ongoing dyspnea. And this caused a lot of confusion and uncertainty because it was so unexpected. And it actually led to a lot of people sharing their experiences online and with social media and forming support groups. And it's this lived experience that has actually really been critical in educating the public and health people about long COVID. So long COVID is the colloquial term for the definition that the World Health Organization has put together in October of 2021. Basically is recovery from COVID that has been marked by symptoms that last for more than 8 weeks and persist for more than 3 months after initial infection. The symptoms may fluctuate and they may relapse and remit over time. In terms of prevalence, it's hard to get a good estimate of the exact prevalence because of the different definitions used. Prior to 2021, most studies used a definition of symptoms lasting more than 4 weeks. And in a large meta-analysis of over 41 studies, it was found that people who had had COVID had a prevalence of nearly 43% globally of long COVID, slightly higher in people who were hospitalised and slightly less in people who weren't hospitalised. If you think that Australia's had over 7 million cases of confirmed COVID, that means that the prevalence of long COVID in Australia lies somewhere between 1.5 million to 3.5 million people, and increasing every day. So in terms of symptoms, Lauren alluded to previously that everybody's different. And this large patient-led collaborative research project of almost 4,000 patients over 50 countries tried to catalogue the symptoms that were common in long COVID. And what it found was that at 7 months, nearly 80% of people still had ongoing fatigue. A high proportion still had neurological symptoms, including headache, brain fog, tingling. And you can see from that list that almost any and every organ system has been affected. People complain of loss of smell, they complain of chest pain, chest wall pain, swelling of their feet, and many other ongoing symptoms. And as you can imagine, the impact of this can be devastating. The same study found that more than 90% of people took more than 8 months to fully recover, and that a large proportion of these people had relapses of their symptoms triggered either by stress or physical or mental activity. And unsurprisingly, nearly half had to reduce their work levels, and 22% were not working at the time of survey, which was about 6 or 7 months post. In response to this, the Sydney Local Health Districts has tried to come up with a model of care that has put the person recovering from long COVID at the forefront and centre of their care. This new long COVID clinic is led by rehabilitation physicians and neurology in close partnership with the patient's primary healthcare provider. And we are ably supported by a suite of allied health specialists, including physiotherapists, occupational therapists, speech therapists, nursing, social work, and dietetics. And we, of course, are able to refer on to our respiratory colleagues or cardiology colleagues or any other colleagues as needed. So the actual process is that a person is referred to the long COVID clinic. Their referral is then screened at an intake meeting, and then they're seen by myself or other senior medical colleagues, and then managed within our relevant long COVID team. And of course, importantly, the primary care physician is the person who looks after them ongoing because they know them best. So management includes an assessment of that person's individual needs, a program tailored to the client, and this may include education around pacing and prioritisation and symptom management, and exercise tailored to the individual. This is particularly important because in long COVID, there's a small subset who have severe disease with autonomic features. And my colleague, Professor Jenny Allison, has been instrumental in helping me work through what's appropriate. So thank you, Jenny. The management may also include strategies for memory and thinking, as well as advice on a phased return to work. So how to refer? We will be operational very shortly. You can refer to us through the centralised email or via health pathways, which are currently under construction in collaboration with our primary healthcare colleagues. I'm very grateful to the SLHD executive team, as well as our many collaborators for their input to try and make this the most patient-centred clinic that we can manage. And I'd just like to thank the Long COVID Clinic Working Party, our respiratory colleagues and many other colleagues at RPA and Concord, as well as the University of Sydney, RPA Virtual and Central and Eastern Primary Health Network. Thank you.
Thank you so much, Dr. Chia. Ladies and gentlemen, our last speaker is Ray Hadley, OAM. He is a radio broadcaster with an extraordinary history. I'm simply going to say number one in his program on 2GB in the mornings forever. He's just been number one forever. And he's the most awarded broadcaster in the history of the Australian Commercial Radio Awards. But Ray, what we want to thank you for here at Sydney Local Health District is the massive work you've done to let your audience know about prevention of the condition we've just been hearing about. Please welcome Ray Hadley.
Thank you, Julie, and good afternoon, ladies and gentlemen. And may I start by saying this all started. I wondered why an ageing shock jock should be part of such an erudite occasion. And Dr. Anderson has been absolutely stellar through all of this with the media, particularly with me. And when I had my fourth jab a while back, she said, "Why don't you come and talk to our people at our symposium?" And I said, "Well, really?" I said, "You've got all these experts." She said, "Oh, you might do something a bit different and talk about it, and they might enjoy it, they might not. So I'll know in the next 15 minutes whether you're still here, whether you're enjoying it, or you'd rather listen to health professionals." But it all started with me when the vaccination process started. I couldn't believe the number of people, some of them my colleagues, who were suggesting you shouldn't get vaccinated. And people like Clive Palmer and Pauline Hanson. And they started to give support to that fringe group of anti-vaxxers who I detest. And I had a conversation with Pauline one day and I said, "Look, as much as, you know, you're trying to do the right thing, I'll take my health advice from Professor Graham Stewart and other people like him. I won't take it from the leader of One Nation." And I was, you know, basically looked down upon by many from, I guess I'm a right-wing shock jock, obviously, and those from the extreme right looked down their nose at me because I looked like I was leaning to the left. And I said, it's not about your politics, it's about actually helping people get guided through this terrible process. And the longer it went on, we had suggestions from people, prominent people in the community, that you should go and get this and get that, and maybe go and see a witch doctor and get a spell put on you so you wouldn't get the virus and you'd recover. Finally, common sense prevailed and we got to 95%. Double vaccinated, and one of the things that I started talking to the Premier about was, and this is everyone in this room, when this is over, and it's not over yet as we've been shown here through long COVID, there needs to be an acclamation of all of you people and your colleagues, every one of you, for what you've done. And I heard earlier the acclamation of nurses, but it's everyone, front office, those dealing with patients, those dealing in those dreadful circumstances with that PPE. every shift, covered from head to toe, unable to breathe, treating people who are also unable to breathe for a different reason. And I suggested to the Premier that, I guess it's a bit cliche to have a day, a march, because you're all too busy. You're all out there saving lives. So I said, why don't you strike a medal, a COVID medal, with the necessary documentation presented to every health worker in New South Wales to acclaim what they've done through this 2.5 year, 3.5, 4.5 year period. And I got some support for that, and I'm hopeful before the next election in 2023 we might be able to push him across the line. I know that it's not going to repay all you people for what you've done, but it is a token of the esteem in which you're held, because without you, and it's a very hackneyed and cliched expression, we're all buggered. We're all buggered without you. We really are. And, I've had family members, fortunately, touch wood, I haven't had COVID. It's remarkable that Dr. Anderson should prevail upon me to come here, and now she can't be with us because of bloody COVID. And so I rang Corinne, her media advisor, and Corinne was also someone who said, come and tell your story, and she's a former colleague of mine in radio, and I rang her just half hour ago, so I'm here. She said, good, I'm at home. I said, what, you've heard me talk before, have you? She said, no. My husband's got COVID, so I can't come either. So I know that there are varying age groups here and you're all dedicated to your profession, but she said, tell your story about where you came from and where you've ended up. And we just celebrated our 141st consecutive victory, which is 18 years unbeaten. And it started with a kid from the western suburbs of Sydney living in a housing commission estate with a father who was a butcher and a mother who worked, and only older people remember this factory, the Vincent's Powder Factory. Remember Beck's and Vincent's? Killed your kidneys, but people took it anyway. That's where Mum worked at Gladesville, the Vincent's Powder Factory. We always had plenty of Vincent's at home. I don't know whether they took it a lot. Anyway, I wanted to be a race caller when I was a kid. That was all I wanted to do. I used to listen to Ken Howard and Bert Bryant and Vince Curry in Brisbane and just aspire to be one of those fellas. I just thought, gee, that'd be a good job calling races. So having done the high school certificate for the second time in 1972, and had I added the two scores together, I could have done medicine. Unfortunately, they wanted me to do it once and I couldn't do it. So I looked through the papers of the Herald. I couldn't find a job as a race caller, strangely enough, so I found one as a trainee auctioneer, and that's what I did for the next 6 years. I was an auctioneer for an old pastoral company which is no more, called Pitson and Badgery. I did clearing sales, cattle sales. In the end, I was doing jewellery sales and machinery sales. Any sales they wanted me to do, I'd do. But I still had this longing to be a race caller, not thinking I'd ever get to where I am at the moment. And so it's funny, you'll jump in a cab and you see a young bloke driving a cab and you think, oh, he must be at uni, or he's just arrived from somewhere else, he's trying to get a quid. So having applied for many jobs in about 1980, 81 to be a race caller, I couldn't get one, strangely. I had no experience. I just thought I could do it. So I started driving a cab. I quit auctioneering and I drove a cab. I used to drive a cab on Thursday and Friday night and earn about the same money I did for auctioneering 5 days a week. And my life changed on a Tuesday night. The owner of the cab rang me up and said, do you want to take the cab out tonight, mate? And I said, oh, there's no money Tuesday night, John. He said, well, you can have the cab for nothing, no paying, just take the cab. Whatever you get, you can earn. It was worth 30 or 40 bucks at the time, back in the 1980s. So I took it out. I was sitting on the rank at North Sydney Station, and this is before computers, it was a radio call. Miller McLaren to North Ryde. Point car the rank. I took the job. I picked up a bloke called Mark Collier, who'd filled in that night for the late John Pearce, a great broadcaster from years gone by. So on the way to North Ryde, he said, are you a uni student? I said, no. I said, I'm actually a race caller. And you're driving a cab on Tuesday night, I glean you're not a very good race caller. I said, fair call. So anyway, that cab ride changed my life. Driving a cab I wasn't supposed to drive, because about a month later I gave him my number and said, if you ever want anyone to do anything, I'm your man. He rang my mum. We didn't have mobiles back in those days. And he said, can you tell your son to ring me? I rang him and he said, you still driving the cab? I said, yeah, but I've got news. I'm calling the dogs at Appin. He said, you have progressed. I said, and Bulli, and Nowra. He said, geez, you're going to look a house on fire. But I still drive that cab because I can't get enough money out of that. I used to call 15 races at Appin on a Saturday afternoon from 12:45 to 4:45 for $32.50. And I did that for about 6 months, and I went to the old boss, Jock McDonald, who ran the place with an iron fist, and I said, Mr. McDonald, I said, I've been here for 6 months, I think I'm going all right. Do you reckon you could stretch it to $40? And this was at Appin, out past Campbelltown. He said, $40, you're travelling all right. He said, you get a cab here every week. I said, no, I'm driving it. He said, all right, because what I'd do, I'd work Friday night and drive the cab to Appin and call the dogs, jump in the cab and pick up a fare at Campbelltown, back into the city, and off I'd go again. So Collier rang me and said he wanted me to do traffic on the breakfast program with Gary O'Callaghan, the great radio broadcaster of that era from the 60s through the 70s and 80s. So I started doing traffic. Then I got 2IC to a bloke called Des Hoysted, a great race caller, then John Tapp. And then in 1986, having been a race caller, someone offered me the job to call the football in 1987. And I've done it ever since. In fact, on Wednesday night next week, I'll call my 91st State of Origin game. So, and my dear friend and colleague Ray Warren retired yesterday. He's at 99. And he said, why don't you do what they did with Donald? When you get the 99, retire. I said, no, we're mates. I'm getting the 100. I'm going to beat you. So then I was at 2UE. I got the bullet in the year 2000. Southern Cross Broadcasting took it over. I didn't know what I was going to do, so John Singleton owned 2GB and phoned me and said, you want to come and call the football here? And I said, look, I'd have to think about it, John. It's a genuine and generous offer. He said, don't think too long. I just heard you got the sack at 2UE. I said, OK, I'll be there tomorrow. That'll be good. And then about 3 months later, Alan Jones came from 2UE. I was doing breakfast at the time. I went to mornings. And John Singleton said to me, I want you to do mornings. And I said, well, I brought Bob Fulton and Peter Frelingos and Blocker over here to do the football. I can't desert them. He said, well, I want you to do mornings. And I said, we'll have to do both. What do you mean you'll do both? I said, I'll call the football on the weekend. I'll do the weekday show Monday to Friday. He said, you can't do it. Well, for the next 12 years, I worked 7 days a week at great cost to my family. But I was ambitious, and one of the things I look at my adult children now, I've just become a grandfather for the 5th time, a beautiful little boy called Tommy. And I look at my children now and look at the hard work they do, my son and my 3 daughters, but they still find time to spend a lot of time with their children. My generation didn't do that. My generation just worked. And one of the things I'm very proud about this generation, your children, or you people yourselves, you spend a lot of time with your kids, and that you can't get that back. Cop a tip from me. You can't get it back. And that's why I spend as much time as I can now with my grandchildren. So after I did that period with the 7 days a week, I decided I'd have weekends off, and I do that now, work Monday to Friday, have a wonderful time. I'm blessed. I'm living a dream that was a dream of a kid from a housing commission estate in Dundas Valley, and it's just, sometimes I pinch myself to understand how lucky I am. And I'm full of admiration for all you people, as I started saying a little earlier. What I do is a bit of fun. Sometimes I get things done, sometimes I don't. But what I have done over the last 2.5 years is champion you people, because you deserve a champion. Because everything you've done for the community, and we'll never be able to repay you in real terms for what you've done. God bless you all, and thank you for having me here.
Ladies and gentlemen, Ray Hadley, thank you so much. Just before I ask John Ajaka to come up and close proceedings, I want to tell you one thing, and we're just going to look at some video highlights of today. There are still 100 people watching online, and so a big welcome to you, and thank you for staying with us. But let's just have a little look at highlights from today.
Welcome, welcome, welcome. We would never have made it through the traumas of the pandemic experience that we've all endured without you. So thank you, one and all.
That if you use technology, you can actually completely redefine how care is provided to our community. That the next couple of years are going to be really interesting for all of us, particularly at this district.
People, perspectives and experiences remain our most powerful drivers of research and innovation.
How do we capture the experience of patients in real time in a way that we can address issues promptly and quickly before we act on the messages that we're hearing?
But if we put the centre of gravity back into the patient so that I carry around with me my x-rays, my scripts, and then as I need to access services, I then share that with the service provider.
For the consumer, digital isn't kind of part of that. It just happens. They just get a message and things work. But it's about the relationships and people and how we can connect those people up.
If we can make a healthcare provider's job easier by taking away some of the admin burden and allow them to spend more time providing that humanity, that kindness, that care, then that is successful digitisation of the health system.
Ownership doesn't become a burden of ownership for patients, and I think that's a really important consideration, to have that lived experience insight into design and decision making when we're actually creating these systems and these products.
Somewhere around 1 in 100 to 1 of 200 Australians live with chronic treatment-resistant depression for which they have very few, if any, treatment options. We have seen some hope emerge, but it's actually emerging from the repurposing of illegal drugs. You may have heard a little bit about this around ketamine and psilocybin.
It has enabled me to kind of have a better quality of life and be able to kind of live like, I guess, a normal human being and do the things that people do take for granted, like getting up and showering every day, cleaning the house, doing dishes.
I've gotten some good feedback and it's just been really, really nice to show the work and, I don't know, tell my story and tell the story of the clinic.
Hospital admissions and reoperations with increasing frequency. Overall, the two on-state groups.
We would love all dads to be doing that, regardless of how small your baby is, even if your baby's 600 grams. I'd love for dads to be holding their baby in the first 72 hours, and of course attending our fathers group and feedback from our staff.
IV LED app, which we believe will support patients attending the metabolism and obesity service beyond the hospital.
The topic is healthcare is now a technology industry. Get your capo hands ready. Fair thing is to say that was a tie. Can you help me? Ladies and gentlemen, a huge thank you to the technical team who've done that in real time. It gives me great honour now to ask the Chair of the Board, John Ajaka, to close proceedings. Please make him welcome.
Where does one start? Look, first, it's appropriate to thank Minister Brad Hazzard and Dr. Teresa Anderson. It's, as has been said, it's a bit ironic that they're not here, Teresa with COVID and the Minister being ill, but I know that they've been watching and they've been ringing me, and as I indicated earlier, I can assure you the Minister is ill because he couldn't actually talk, which is very, for those of you who know the Minister, quite unusual. But really, it's what a wonderful opportunity to bring us all together, an incredible one. I do need to thank our event partners, the Hyatt team for hosting us, all of our presenters, all of the delegates and everyone who joined virtually, the Symposium event team and all of the teams responsible for these events during it. But most importantly, I want to thank each and every one of you. I want to thank you for all of your care, your strength, your empathy, the way you came together to help each and every one of us. As I indicated to you, I got COVID on Christmas Day. The entire family got COVID. And, the way we were looked after, taken care of, RPA Virtual, the entire team was just extraordinary. I'm truly honoured to be the chair of this incredible Sydney Local Health District. I confess that I brag about you to all of the other chairs of all of the other local health districts. Ray, I tell them I have the best team in New South Wales. They get upset, but incredibly, they can't prove I'm wrong. They know I have the absolute best team. But to put it, as Ray Hadley said, you truly are champions, and I thank each and every one of you for what you do.